In this edition of Health Topic, the top 10 facts you may not know about the current COVID-19 global pandemic. Are the safety measures you are taking really helping? Stay tuned and find out what to do to protect yourself and loved ones. Hi and welcome back to Health Topic, bringing you the latest updates in health, wellness, and prosperity. Before we begin, be sure to like and subscribe to our channel to be the first notified of our latest content. Stay fantastic and in the know. The coronaviruses are a large family of viruses that cause the common cold, dry cough, or in a more severe case, an acute respiratory syndrome. First identified in December 2019 in Wuhan, China, this new coronavirus was given the name COVID-19. COVID-19 is spread through airborne respiratory droplets from sneezing, coughing, and talking from a close distance. The World Health Organization studies suggest that COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. As of May 17, 2020, there have been over 4,750,000 cases and over 300,000 deaths worldwide. The pandemic is threatening to upend decades of economic progress and endangering the future of a generation of children. It is of paramount importance now that we prevent the spread of this pandemic or minimize the risks. Stay with us until the end of the video to find out the top 10 facts and misconceptions about COVID-19 you may not know about. Let us begin. Number 1. Thermal scanners cannot detect the novel coronavirus. Although thermal scanners are effective in detecting individuals with fever, COVID-19 cannot be detected using them. If detected with a fever, please seek medical attention, as there are various causes of fevers. It does not necessarily mean you are down with the COVID-19 disease. Number 2. COVID-19 spreads through our pets. Although respiratory droplets can still stick to coats or furs, there is no significant evidence that pets play a huge part in spreading the novel coronavirus that causes COVID-19. Although the risk remains low, it is still advised to practice proper hygiene on our pets, especially after being exposed outside. Number 3. COVID-19 is not airborne. One of the most common misconceptions of the novel coronavirus is that it spreads through the air. It is, however, mainly transmitted by contact with respiratory droplets that can, under certain conditions, appear to be more airborne. It is advised that the required distance from one another when practicing physical distancing is at least 6 feet, or 2 arms length. Number 4. COVID-19 in animals. The first alleged source of the novel coronavirus was that it came from animals, especially bats. Investigations are still ongoing, so it remains to be seen. However, as a safety precaution, it is advised to ensure good food handling at all times. Avoid direct contact with exotic animals and surfaces possibly in contact with them. It is also encouraged to carefully handle raw meat and to avoid consuming possibly contaminated meat if undercooked. Number 5. The weather does not affect the transmissivity of COVID-19. In some cases, viruses like the common cold or flu spread more during cold weather. However, it is not confirmed yet if this is a case for the novel coronavirus. As investigations are ongoing, it is not known yet whether temperature or the weather directly affect the spread of COVID-19. Additionally, exposing yourself to the sun or to high temperatures does not guarantee to prevent the novel coronavirus disease. Did these facts help you better understand the COVID-19 pandemic we are facing now? Stay with us until the end of the video to find out the rest of the top 10 most overlooked facts. Number 6. People with higher risks of COVID-19. The novel coronavirus investigations are still ongoing. There is limited information about who can get infected. However, based on CDC, those at higher risk include people aged 65 years or older, people in nursing homes or long-term care facilities, people with chronic lung disease or moderate to severe asthma, people who have serious heart conditions, people who are immunocompromised, people with severe obesity, people with diabetes, people with chronic kidney disease and are undergoing dialysis, and people who have liver disease. Number 7. The difference between cleaning and disinfecting. Cleaning removes germs, dirt, and impurities, usually with soap and water. The risk of infection is lowered. On the other hand, disinfecting kills germs and bacteria on surfaces and further lowering the risks of spreading the infection. Chlorine dioxide is a common example of a disinfectant. Number 8. Antibiotics cannot treat it. At the moment, there is currently no vaccine or drugs licensed to treat or prevent COVID-19. The use of antibiotics to treat or prevent the novel coronavirus may only result in the development of antimicrobial resistance, where the virus becomes even more resistant against treatment efforts. Number 9. COVID-19 cannot be transmitted through mosquito bites. Although mosquitoes are the cause of over 500,000 deaths each year, it is not scientifically proven that they can transmit the SARS-CoV-2, the virus causing COVID-19. It is unlikely for a mosquito to pick up the virus from a person infected by COVID-19, let alone be able to pass it on, based on current understandings. Being precarious is advised to keep in mind. Precautions must always be taken against mosquito bites, as they can cause other illnesses, which lowers our immune system and allows us to be at higher risk of catching the novel coronavirus. Number 10. Physical distancing over social distancing. During the earlier stages of the quarantine, it was announced everywhere to practice social distancing to prevent the spread of the novel coronavirus. However, the World Health Organization is concerned that the use of the term social distancing might be misinterpreted. Instead, they suggested that physical distancing be the politically correct term, as it promotes keeping a physical distance from one another while maintaining our social ties. Social connection is key in strengthening relationships to help one another fight through the current pandemic. You've just seen the top 10 most recent facts about COVID-19, common misconceptions, and additional recommendations on prevention that you may have not known. Which fact had the most impact on you? Did we miss out on any interesting facts about the pandemic? Share your thoughts with us on the comments section below and let's discuss. We have a chance to do something great even through our own little ways to stop the pandemic. When this is over and we are allowed to be with one another again, may we never take every handshake, hug, or kiss for granted. For more information about the latest in health, wellness, and prosperity, hit the like button or subscribe to our channel by clicking the bell icon. Stay safe and stay healthy, and see you in the next edition of Health Topic.